sit in the movies, you're sitting at dinner, perfectly comfortable, and all of a sudden, whoosh, out of every pore in your body comes sweat, like the world is burning up, and you're suddenly stripping off all your layers. Welcome to menopause, and welcome to the world of hot flashes. I'm Sarah Heiner, president of Bottom Line Publications, and this is our Conversation with the Experts, where we get the answers to your tough questions from our leading experts. Today, I'm talking to Dr. Holly Lucille, a leading naturopathic physician and expert in integrative medicine. Dr. Lucille was listed in Time Magazine's Alt list as one of the top 100 most influential people and is the author of Creating and Maintaining Balance, a woman's guide to safe, natural hormone health. You can learn more about her at drhollylucille.com. So welcome, Holly.
Hey, thanks, Sarah.
All right, hot flashes. Why is your body suddenly kaflooey when it comes to its own inner thermostat?
Well, you know, honestly, I asked this question, does anybody know what a hot flash is? And one person said, yes, it's my inner child just playing with matches, which I thought was hilarious.
That's good.
But quite honestly, we're not exactly sure the direct mechanism that's going on. We do know that the hypothalamus, which has many, many hormonal receptors in it, is your temperature setting regulated tool in your body. And there is a shift, and it definitely is going through changes in menopause. And certainly those vasomotor symptoms of hot flashes and night sweats are two of the things that we see.
You know, I understand getting hotter, I understand getting colder, but it's interesting that it just can't decide. And out of the blue, it just, as you said, goes kaflooey.
That's right, it goes kaflooey. So your body is also brilliant, right? And it's always trying to take care of you. So instantly when that happens, there is a cooling mechanism that wants to start to kind of cool things down. And that's why definitely it's like, oh, you're hot, and then, oh, you're cool. And so this is a tough, tough, tough thing to manage sometimes.
Well, I know, and I think it's one of the ones that actually drive people crazy the most, and maybe because it's the most kind of chronic and frequent.
Yeah, and it's the biggest thing that, as far as menopause is concerned, as a practitioner, one of the things that I do is like, look, let's see what we can do. But you've got to be able to really address acute concerns, and quality of life issues and health, quite honestly, can get quite disturbed if the night sweats are precluding somebody from getting a really great restorative sleep.
So is there anything that someone can do to minimize their risk or even out the hot flashes at all, or like reduce it? Is there anything that they're eating or drinking or sleeping or something that they're doing that's triggering or making it worse?
Yeah, so you know, there's very common recommendations out there to avoid what? Wine, spicy foods, right? Food sensitivities, things that you know are triggers for yourself. I took this a step further. I actually have a presentation that I gave actually to doctors. I was like, what does digestion have to do with hormones anyway? And I discovered that, yeah, exactly. Well, but I discovered that if we have poor digestion and we have something called hyperpermeability, and that's just your leaky gut, we call it, from the patient's perspective, there's something that happens, it's called diapedesis. You don't have to remember it, you don't have to look it up. It's part of our inflammatory reaction, and it literally is vasodilating, so dilating blood vessels. It shoos on that hot flash. I have definitely been able to help women decrease their hot flashes and night sweats by getting their gut in shape. I know, it always goes back to the gut.
We write regularly about the connection between digestion and pretty much anything in your body, right?
Yeah, we used to say heal the hole, and it's definitely the hole that starts there and the hole that ends there, because so much of your overall health has to do with the way you take in nutrients, digest, assimilate, absorb, later on down the chute, getting rid of those waste products.
Absolutely. All right, so let's talk about then, I'll call it the classic Western concept of symptom suppression. Like, is there something someone can take to just cool out those hot flashes?
The old here, take this approach.
You know, like I'll call it emergency situation. So, you know, if they switch their diet, they heal their gut, but is there something else that they can take that also kind of calms it?
Absolutely. There's been clinically studied ingredients and plant medicine, so botanical medicines. Black cohosh is by far the most widely used and clinically studied plant medicine. It's been proven very, very effective against hot flashes and night sweats. But here it is. Doctor in Latin means to teach, docere. Black cohosh takes some time to get therapeutic levels in your body. So we're looking at about 7 to 12 weeks. So that's my biggest shout out and talking point regarding a recommendation like this, because the last thing I want is for women to go and get some help. They get a clinically studied brand of black cohosh. They take it for 2 days, it ain't doing anything. So there's also lifestyle things to do, but concomitantly, definitely get that black cohosh on board.
Well, and something that, again, I've talked about forever at Bottom Line is that natural medicine isn't do-it-yourself medicine. So just because something's natural doesn't mean you just go to Whole Foods, you buy the bottle of black cohosh, you take it home and you do it. That we always recommend that somebody talk to their own practitioner about it and make sure that it doesn't conflict with anything that's in their body, anything else that they're taking. Is that your recommendation as well?
It really is, and I would kind of yes and that. I mean, certainly, because the other thing that I think about as far as this more natural comprehensive medicine that you and I live and eat and breathe and sleep in every single day and night is that usually from a clinical perspective, we're looking at the fact that there are multiple contributing factors. So guess what? The treatment paradigm has to be that way too. Sure, there are clinically effective, safe, natural ingredients, but also we're really depending on people actually for the do-it-yourself part, which is you got to be able to make these dietary changes, lifestyle changes, changes in your environment. Certainly to mitigate hot flashes, there's all sorts of things that you can do. Staying more hydrated, avoiding foods that you know, things like that. So it kind of is really a partnership in this style of medicine.
If somebody goes to their medical doctor, the medical doctor may or may not really understand some of these things. So in fact, they may need to go to a specialist or a naturopathic physician.
I love that. Yes, I think you're right, because one of the things we need to remember as consumers of healthcare really is that there's different systems of medicine, and I think there's value in all. Conventional Western reductionistic medicine, they're taught to think in a very reductionistic way. As you said, here, take this, symptom suppression. There are so many things going on with menopause, and now in naturopathic medicine, I call it common sense comprehensive medicine, or more common sense. It's just a different system. We think of it as the science of vitalism. This is a normal phase, right? And we're not supposed to be as symptomatic as we are, but so if we are, guess what? We need to understand all the contributing factors and identify and treat the cause.
And I promise I'm not shilling for the Naturopathic Physician Association, but it's even also that the medical doctors haven't been trained in the botanicals, and the naturopaths have. So
that's correct. You know, I took pharmacology in many, many semesters of it, but I also took botanical medicine. Knowing the pharmacognosy, the mechanism of action, the contraindications of plants, forget about it. I mean, that's where I think my brain cells were left on the floor of my medical degrees. It's intense. This stuff is powerful. The World Health Organization, it knows that botanical medicine is the #1 used medicine in the entire world. These are so effective.
But they're effective, which means they're effective, they work, which means they're powerful, which means you want to be guided by somebody that's expert. But so black cohosh, one of the top things you can do. Anything else you mentioned, kind of lifestyle changes that somebody can make to be able to minimize the hot flash?
I think certainly prevention is the cure, right? So if you know that you're in this stage and you're sort of rolling through menopause in a natural way, mitigating symptoms, make sure you do those things like dress in layers. Also your bed, you can change the sheets. There's actually specialized sheets that are actually cooling. And so anything to bring down that body temperature naturally and also staying hydrated is extremely important.
I was just going to say that if you're sweating that much more, even more water.
That's right.
All right, and any risks? Does it ever cross a line into being excessively hot flashy, or a place where they need to go check in with their doctor?
Well, I think once again, once that sleep starts to get disrupted, you are setting yourself up on a slippery slope for other health conditions. And so getting help and being able to sleep, even in acutely, maybe we could work on some of the other contributing factors, but if somebody is lacking sleep and it's starting to snowball, perhaps even, like I said, value in all systems of medicine, you might need a sleeper on board. We'll make sure that there's a good exit strategy for that, but for a while, just to get that person started.
All right, well, thank you, Dr. Holly Lucille. The bottom line on hot flashes, it's a part of the natural process of menopause. It really is. Your body's adjusting, your hormones are shifting. So they're not to be feared, but there are things you can do to mitigate it. #1, actually, surprisingly, is your digestive system. Work with an expert to help you be sure that your digestion is operating as efficiently as it can, because that way you won't have toxins and you won't have hormones leaking where they shouldn't be leaking. Stay well hydrated. Black cohosh can absolutely work, but it needs some professional guidance. This is Sarah Heiner with Bottom Line.